You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. Hey there, it's Dr. Justin Marchegiani. Welcome to today's podcast. We're going to be talking about utilizing functional medicine principles and assessment to figure out how your gallbladder is doing. Also talking about what we can do about it, what are the common gallbladder symptoms, what are root cause solutions, and how we can get you better. We know digesting fat is so important for your hormone health, for healthy cell membranes. Every single cell has a lipid bilayer. And also, if you want to be a good fat burner on a ketogenic template, it's really important we have great gallbladder function. So, Evan, welcome to today's podcast, man.
Hey, man. Thanks for having me.
Awesome. Well, let's dive in, brother. I'm excited to dive in. So first off, let's just first dive in just to kind of physiology 101. What is the gallbladder? Why is it even so important? So off the bat, gallbladder is kind of in this upper right quadrant here, just beneath the rib cage. Okay. If it's tender in that area, like they'll do a palpation, that's called Murphy's sign, in that area where they'll look for a tender type of gallbladder issue where the gallbladder is inflamed. But the gallbladder, it basically concentrates bile at about a 15 times amount than the common hepatic bile duct in the liver would. So when you have your gallbladder removed, that common hepatic bile duct up in the liver just drips bile all the time. It's not specific. It's not during a fatty meal. It just kind of hits, and you can definitely have some bile acid diarrhea issues. When you have a gallbladder, it concentrates that bile 15 times, and then it allows it to come out and time it. It squeezes, it contracts, and puts out that bile, especially during a fatty meal, because you have these hormones in your stomach. When that that mixed up food in your stomach gets released into the small intestine, the nice acidity of that stimulates this neuropeptide called cholecystokinin, or CCK for short, and that causes the gallbladder to contract and stimulate all this bile release, which helps with fat digestion. When we don't have a gallbladder, we're not going to be able to break down fat optimally through biliary concentration.
Yep. So you ran into that fast. So I'm just going to repeat it so it gets into people's heads. So you say when you put food down the hatch, especially fat, it enters the digestive tract. The body says, okay, boom, there's fat in here now. I'm going to start making CCK, and that comes from your duodenum and I believe the jejunum as well. And then to respond to the CCK, then the gallbladder goes, oh, CCK's in the neighborhood. Now I'm going to release my stored bile because we've got fats to take care of. So then the bile, or they call it gall, will start working on these fats and then turning those fats into usable fuel.
Yeah, think of emulsification as like you have a greasy pan and you put a drop of like soap, right? Like some dish soap, like Dawn dish soap, and it kind of breaks it up. It emulsifies it. Think of that's what's happening is you get this greasy pan in your stomach, which is all the fat in your stomach going into your small intestine. That emulsifies it and allows your body to break it down and absorb it. It goes into these little things that form a micelle, and that allows it to get into your body and be able to utilize it. Now, going up one kind of marker is hydrochloric acid levels. This is even important. This is even more important because hydrochloric acid stimulates
it lowers the pH, and a nice low pH triggers cholecystokinin. So we also need good pH function, good hydrochloric acid function, and then in the small intestine really gets the bile going. And then we also have some enzymes in the pancreas called lipolytic enzymes, lipase enzymes, that also help with the pancreas, with the gallbladder in the bile digestive process.
Well, you make a good point, because when we jump into this conversation, if we look at the whole digestive cascade as a big row of dominoes, when you get to CCK and you get to the gallbladder, you're really talking 3 or 4 dominoes down the list. But it's good that you went upstream first to the mouth. That's where you're chewing your food. Hopefully you're chewing your food. You're not rushing through your meal. That's why I don't like things like Chipotle. I enjoy the food itself, but it's all soft. It's mushy meat and rice and guacamole, and you can just shove it down the hatch and you barely have to chew the stuff. So if I eat a soft meal, I still try to be very cognizant about chewing, telling the digestive system, hey, something's coming down the hatch. But you make the point about HCl. This is why it's so important when we're talking about gallbladder symptoms, which we'll get into in a minute, to look for and to treat, if you have them, H. pylori and other infections. Because if H. pylori is reducing your HCl levels, well, you can't go straight to the gallbladder. I mean, you can take bile salts to help it, but you didn't fix the root cause. It was the H. pylori.
Exactly. So kind of highlighting, we went from the gallbladder, what's happening at the gallbladder, upstream to HCl. And that also activates other enzymes in the stomach called pepsin. It also gets the pancreas producing lipolytic fat breaking down enzymes, and then proteolytic protein breaking down fat enzymes. It's very rare that you just have fat by itself. Typically fat, protein, and cholesterol tend to come together. And then up one stream above is the chewing part. We want to make sure we're chewing our food at least 32 times. That's about 1 chew per tooth, right? You have 32 teeth, so think of 32 chews, 32 teeth. And in general, getting your food to like an oatmeal-like consistency. Like if you're having a food that's kind of more pre-digested, like a Chipotle meal, you got to just make sure you chew it up to that good oatmeal-like consistency and try to be in a relatively stress-free environment, because the parasympathetic nervous system is really important for HCl secretion, thus enzyme secretion, and thus bile secretion, because we need that nice acidity, we need the enzymes, we need the digestive secretion. And if we're in a sympathetic state, all that blood flow is going out to our extremities, our arms and our feet to run, fight, and flee. So it's very important that we have good parasympathetic. So good breathing, gratitude, being in a quiet, kind of relaxed setting to start our digestive processes.
You know, I was trying to find some research on this. I am just going to guess, based on the mechanisms we discussed, that people on acid blocking medications probably have more issues with gallbladder. Would that make sense? Because let's say you don't have H. pylori infection, but you're on an acid blocking drug. Isn't that going to just downregulate this whole process we're talking about?
Yeah, well, we need good acidity to trigger that CCK. So that totally makes sense, right? And then we need to be able to break down good fats. What are good fats? Well, we have our mono unsaturated fats are going to be things like olive oil, avocado oil, and then maybe even some nuts and seeds. We have more saturated fats, which are going to be animal products, right? Grass-fed beef, any of our fish, chicken, beef stuff. You're going to have omega-3 fats, which are in the polyunsaturated category. Omega-3s, more polyunsaturated. And then you also have your saturated coconut oil, which I think is your only plant fat that's saturated. Maybe that and palm, I think, are the only 2 big saturated ones that are plant-based. So we have our saturated fats, right? Coconut, plant-based fat, coconut and animal-based fats. We have our monounsaturated, which typically are going to be a lot of the olive oil, potentially avocado oil. We have our polyunsaturated a lot of times, which are fish, and then maybe some of the nuts and seeds kind of fit into that monounsaturated category, omega-6 kind of category as well. And then we have our vitamins A, D, E, and K, ADEC. These are our fat-soluble vitamins. So if we don't have good bile support, we're not going to be able to break down vitamin A, which is really good for our thyroid function. It's good for our skin, right? Higher dose vitamin A is great for skin. That's why they use Accutane, which is a vitamin A analog to shrink the oil cells in the skin. Also great for our eyes. Vitamin D, obviously great for our immune system. We make it too from the sun. Vitamin E is great for our heart. It's a natural antioxidant, great for inflammation. Vitamin K is really good. It's found in butterfat. It helps get calcium into our bone, right? Vitamin K2 considered activator X by Weston Price. Really important nutrients. So these fat-soluble vitamins, we really need good gallbladder function to absorb them.
Yeah, and if you don't have a gallbladder, we'll get into that in a minute. I was just looking up, reading about the surgeries that people get. When you get into the gallbladder world, gallbladder surgery is just such a huge, huge moneymaker, and it's done oftentimes in cases where it didn't have to be done. And I told you we need to get a lady on who's got a specific website about protocols for people with gallstones to try to help give them relief and to save their gallbladder. But another surgery, which is crazy to me, is called fundoplication, and it's what they do to relieve chronic acid reflux. The surgeon tries to recreate your lower esophageal sphincter by taking the upper portion of your stomach and wrapping it around the lower part of your esophagus and sewing it into place.
Wow.
That just seems insane to me. They call it anti-reflux surgery. How many of those people just had H. pylori infections or were put on acid blockers? Therefore, that LES, that lower esophageal sphincter, wasn't working properly. Or maybe they had a mineral deficient, or maybe it was a fascial issue and structurally that could get adjusted. But instead, they go get their stomach wrapped around their esophagus and sewn together. That's insane.
It really is. And that's kind of what conventional medicine does. They can go to some extremes to fix things that, in my opinion, are much more foundational and much more simple. And most of the time, I would say 99% of the time, the surgeries aren't root cause, right? Yeah. So if we look at the conventional side, we have things like a HIDA-scan, which is like a nuclear image. They swallow some solution that's nuclear, and they can see kind of biliary function, right? You want typically a 33 to 40% kind of ejection fraction. That's normal on the gallbladder. So you can look at that with a HIDA-scan. You can even look at an ultrasound to give you a window of the inflammation in the gallbladder. It's not going to give you how much bile is flowing to the duct, but it'll at least give you, okay, is it stagnant? Is there stuff in there? Is it inflamed? You can kind of get that sense as well. A lot of times they'll do some conventional testing, because if your gallbladder is inflamed and there's an immune response, you may see white blood cells on the higher side, right? You may also see certain liver enzymes. ALT is a common liver enzyme. AST is another enzyme that can be effective in the skeletal muscle. You can see GGT. Think of the G in gallbladder. GGT is a big gallbladder enzyme. Bilirubin is a byproduct of red blood cell metabolism that comes out in the gallbladder. With high bilirubin, we may have some backed up gallbladder bile issues. And then also, I think alkaline phosphatase is another big one that we may see on the higher side. So we're going to see bilirubin on the higher side, alkaline phosphatase on the higher side, and then we're also going to see potential HIDA-scan issues. But those are HIDA-scans more like pathological. There are a lot of people that are in between that may be okay on the ultrasound or maybe okay on the HIDA-scan, and we can use some of these functional tests as well. But really important, we got to dig to the root underlying issue on what's going on there. And again, AST is more skeletal muscle, but there's some crossover with the liver. ALT is more liver. Think of the L in ALT as liver. And then the alkaline phosphatase is a big gallbladder one, also a big one for zinc. Alanine transferase for ALT, aspartate transferase, and then alkaline phosphatase for ALP.
Well, the good thing is a lot of the blood markers you just mentioned are pretty standard. So even if you're not working with a functional medicine practitioner like one of us, you may be able to get your doctor to just run these labs, refer back to this podcast and look and see if you have an elevation. Now, the only problem is the conventional reference range for blood testing is very bad. So you may be, quote, normal by your doctored standards, but our reference ranges may be tighter. So if we start to see like your ALT or your AST enzymes go up, it may not be up enough to be flagged. So that's why it takes a trained eye to look at these numbers and see. And we've seen it time and time again. We get somebody on gallbladder supplements, their AST and ALT go down. So it's amazing to see we gave this nutrient, boom, look at the blood changing just based on this nutrient. It's really cool. Let's talk about symptoms now. I think we've given a good...
just to highlight one thing, you just want to get that CBC done, which is a complete blood count, and then also a CMP, comprehensive metabolic panel or profile. And it's important. You need to work with a good functional doc, because you may be okay in a lot of these areas and you still may have issues. So now what, right? So you don't want to just rule it out because some of these testing are good. You want to look at subjective symptoms, connect it to the anatomy, connect it to how your stools look, right? If we have fatty stools, blonde stools, excessive amount of wipes to clean out your, to clean yourself after going number 2, or just you get skid marks on the toilet seat, we're probably not breaking down fat. And again, if you have too much MCT oil in the morning, that can also do it too, because that has a laxative effect. So you got to look at it, the trend in general, clinical symptoms, subjective symptoms, and then lab symptoms to really make a complete picture on what's going on.
That's a good point, because my AST and my ALT on my blood look perfectly fine, but when I had parasite infections, I had that low right side pain under my rib cage where my gallbladder and liver are. Your gallbladder's kind of tucked in with your liver under there. So if you look down at yourself on your right side, up under that rib cage, if you're having pain there, when I had parasites, I had a ton of pain there. My blood looked perfectly fine. So I don't want, like you said, you don't want to give a false sense of hope. Just because your blood looks okay, there may be other functional problems that you'll find by looking at stool testing, for example. But let's hit on these symptoms, because you mentioned some, but we need to just go through symptoms here and tell people, okay, what would you be experiencing? So you mentioned fatty, greasy stools. You mentioned it takes a lot of wipes to clean your butt. You mentioned the skid marks in the toilet, which if everybody's going on a high-fat diet these days, sure, that may be okay. But if you've got gallbladder problems to start, and then you try to go on a ketogenic diet and you don't feel well, or you don't lose weight and you're complaining to your doctor, that may be part of the problem, is the gallbladder.
100%. Also, autoimmune issues can affect the gallbladder as well. Gluten's a big one. It creates this condition called primary biliary. What's that last?
I think you call it cholangitis.
Yeah, primary biliary cholangitis. I mean, typically just PBC for short. But basically, you can have some scarring of this on the kind of biliary tubes that go out of the gallbladder, as well as, you know, the liver goes to the gallbladder. The gallbladder kind of comes out together with the pancreas and comes out the sphincter of Oddi, or the hepatobiliary kind of ampulla, and that can kind of scar and it can sclerose. It can kind of have narrowing of that vasculature. Of course, that can back up, and if that backs up and those enzymes can't get out, you can have pancreatitis as well. But there's an autoimmune condition where your body's attacking a lot of that tubing that goes up to the gallbladder and maybe even connect with the pancreas, and that can narrow and prevent a lot of that stuff from coming out. So, of course, gluten is a big component because that can really activate a lot of autoimmunity, and you can also have a leaky gut, and you can also have a leaky gallbladder, which thus aggravates more autoimmune attack because things that shouldn't be out in the bloodstream are out, and that exacerbates the immune system going after it.
Yeah, so let me just read a few sentences on this whole PBC thing, because I think this is critical. We know even just this is just standard, you know, medical textbook stuff that says it's the most common among women. And we know that Hashimoto's is more common in women than men. So it says here, the cause is not clear, but we know it's more common in people with, guess what? Hashimoto's, thyroiditis.
Yes.
So it says here, an autoimmune cause is thought possible because more than 95% of people with PBC have certain abnormal antibodies in their blood. These antibodies attack mitochondria. What triggers this attack is unknown. Of course, they say that, but it may be exposure to a virus or toxic substance, aka gluten, maybe dairy. I mean, you and I talk so much about autoimmunity, so I'm glad that you brought this up, because, you know, these people may have these symptoms and they're not going to know what's autoimmune in nature. They may just get the knife and say, hey, we've got to pull this gallbladder out. Not necessarily, what if we can shut down this autoimmune attack?
100%. Also, here's the bigger issue too, is, okay, great, the gallbladder is removed. Your digestion is now forever altered. I've yet to meet a conventional patient of a gallbladder procedure where their surgeon said, oh, by the way, you're going to have to add an HCl, or lipolytic enzymes and bile salts for the rest of your life. I've never really heard that. At least bile salts need to be added in. I would say HCl and enzymes too, but I've never heard someone do that. Now, your digestion's forever altered. Do you think there's a connection with now you not being able to break down cholesterol optimally? Because that's going to be in the bile, right? The bile is 97% water. Then you have some cholesterol salts as well. And you also have some toxins coming out. That's why if you have poor, gallbladder emptying, then you're not getting rid of potential toxins that are in there too. So we got to be emptying that gallbladder. If we're not breaking down vitamin A, D, E, and K, if we're not breaking down our fat-soluble vitamins, which I just mentioned, if we're not breaking down cholesterol, which is the building block for all of our hormones, do you think we're going to have problems, ladies, as you get into your 40s and 50s with menopausal issues, perimenopausal issues, PMS? And we know the main connection, it's kind of a slang, but I've heard many, let's just say general surgeons say it, it's the 3 F's of gallbladder issues: fat, female, and 40. And that's the time too, late 40s, early 50s, where hormonal transitions happen. And if you can't break down those nutrients, you are set up for a menopause of hell, so to speak.
Yeah, in terms of side effects, possible side effects of gallbladder removal, it could be anything from pancreatitis to increased risk of colon cancer to increased digestive symptoms like heartburn, could be constipation. So we've seen people that they don't feel well after they get the gallbladder removed. And like you said, there's no surgeon out there saying, hey, I'm going to put you on this comprehensive digestive support protocol after we remove it. No, they're going to knock you out with anesthesia, cut that bad boy out, and send you home in a day or two. There's a whole list of symptoms here I'm looking at now. Symptoms of symptoms after gallbladder removal. I've had women have gallbladder attacks, but they don't have a gallbladder. It's like, well, how the heck does that happen? So, the removal is not the cure-all. Anything from nausea to gas and bloating, distension, burping, belching, feelings of fullness, heartburn, Barrett's esophagus, diarrhea, dumping syndrome, weight gain. There's a whole article here all about post gallbladder removal weight gain happening.
And part of the reason why women get targeted so much, I hate to say it, is the estrogen. The estrogen kind of makes things sluggish and slow. It kind of makes it turn into molasses. So things really are very sluggish, very viscous. And of course, that can affect gallbladder and bile flow. Women that are on, birth control pills, that's going to obviously increase estrogen levels. Obviously, just being stressed, right? You're going to take your progesterone, you're going to shoot it downstream to cortisol, and that's going to basically cause estrogen dominance there because you're already starting to lower progesterone in relationship to estrogen. You're getting estrogen in the environment from the conventional meat products, water, plastics, chemicals, hormones in the meats as well. And then you're also going to be just getting it just from being a woman, having 10 times more estrogen than a man. So you're already predisposed. And then when you add stress to it, it's going to exacerbate it big time. So you really want to make sure that you're fixing if you have a gallbladder issue, you also need to be going after the hormonal issues as well. And then we can dive deeper into the food allergy stuff too. So you got to go after the hormones. You got to make sure you fix the estrogen dominance. You got to make sure you fix the digestive aspects, and then we can go into foods later.
Well, I'm sure there's going to be a ton of people that are just yelling at us right now through their podcast app or YouTube or wherever they're listening to us. And they're saying, well, this is not fair. I already have my gallbladder removed. So what the heck do I do now? So do you want to address that now, or should we talk about that later?
Yeah, so off the bat, the underlying mechanism that was driving that inflammation in the body is still there. Just the end target, the end manifestation of it is removed. But now other tissues may start to have issues. And also, if you don't fix the underlying digestive impediment, which is your fat-soluble vitamins, your cholesterol, your hormone building blocks are now going to be thwarted in their digestive processes. So you have to fix that to prevent compounding hormonal issues 10, 20, 30 years later, number one. And then obviously this serves for if you still have your gallbladder, we want to keep it by doing a lot of the preventative things. But on the food side, I outlined this in a couple of my gallbladder videos I've done in the past, but there are some common foods that are even, let's just say paleo approved, but should probably be look at removing. So of course we have the refined sugar and the glutens. That's kind of a no-brainer right here. But in order of kind of like the most likely offender are going to be eggs. So
Yes.
Definitely autoimmune template, cut out the eggs. Pork, onions, chicken, turkey, milk, coffee, corns, beans, nuts, apples, tomatoes, peas, cabbage, spices, peanuts, fish, rye. I'm going to link my article that goes into this. So everyone's probably like, say it again. No, I'll put the link below. Don't worry. Take a look at the article. All right. But I have them in most likely to offend to least. So if you're overwhelmed after hearing that, like, what the hell am I going to eat? Just start with the biggest 3 or 5, or look at that list and say, what are the biggest 3 or 5 that I eat on a daily or weekly basis? And just pull that out. Once we get the inflammation under control, we support HCl, we support enzymes, we support bile salt production. We look at the gut because sometimes there can be infections like H. pylori and Giardia, and of course SIBO in and around that milieu that can exacerbate everything too. So if we get the infections clear, if we get the acidity and the enzymes dialed in, if we cut out some of the common offending foods, we may be able to start adding some of these foods in over time. But I find pork's a big one, eggs are a big one. Those are like my 2 biggest right there off the bat. And they're kind of paleo friendly too.
Yeah, eggs are huge and people overeat them. And if you have gallbladder issues, when I interviewed Ann-Louise Gittleman, she said the same thing. She said eggs are the biggest offender. And I'm like, wow, I thought that was just me No, it's a real thing. And then also onion. I think you said onion already.
Yes.
But that was a problem for me when I had parasites and I would try to do like a stir fry and I'd throw some onion in there. I'd end up with that low right side stomach pain. I'm like, what the heck is it? Part of it was I had parasite infections, but the other part of it was the onion. So yeah, I, at least temporarily, like you said, going on an autoimmune protocol where you're working with your practitioner to fix the other underlying causes, you're going to be in good shape if you do that.
Onions are also a FODMAP too, so there could be some underlying SIBO or small intestinal bacterial overgrowth going on as well. So you got to look deeper at everything. So kind of like piggybacking everything, all right? Women are going to be the more bigger offenders because of the hormones, because of the, the pregnancy prevention with the birth control pill. So you have that, right? So we got to fix the hormones, Number 2, cut out the foods, at least paleo to autoimmune paleo with those additional 3 to 5 to 8 foods I just mentioned. Get enzymes dialed in, get acids dialed in, and definitely bile salts added in. And if you already had your gallbladder removed, definitely do all 3 and dose that up and watch your stools and make sure your stools go from floating to sinking, right? Oil and water mix. So if you have a stool with a whole bunch of undigested fat and oil and water mix, the stools stay on top of the water. They don't sink. So you want to see the stool sink, and ideally you want to be able to clean yourself, 3 to 5 wipes on average. And you want to make sure when you flush, you're not seeing big skid marks all the time. If you're doing some MCT oil in your coffee, there may be some issues there. Too much of that can cause some undigested MCT. So be mindful of that. So foods, acid, enzyme, bile salts, get the infections cleared. And if you're a woman, get the estrogen dominance fixed, get the hormones balanced.
Yep. And how can you do that from a testing perspective? We mentioned the blood, but I'll just throw a few other key components of this in. Number 1 is the stool test. So we're always going to be running a PCR stool panel. We're going to be looking for all this. As he mentioned, we're going to look at H. pylori. We're going to look for Giardia. We're going to look for Cryptosporidium, Blastocystis hominis. There's a ton of different bugs. There's worms, there's parasites, there's bacterial overgrowth we look at. There's candida that we look at. That's all done with a combination of stool and urine testing. And on the stool, there's a couple markers that we can track. Obviously, you looking in the toilet is going to be the best way to track, but we like numbers. Justin and I like data. So when we look at steatocrit, which is a fecal fat marker that usually is expressed as a percentage, I like to see it, 10% or below. We'll see some clients, they're 30, 35, 40% steatocrit. That means they're not digesting their fats at all. And they say, well, I'm doing a ketogenic diet and I feel like crap. It's because they're not digesting anything. So we got to get that steatocrit down. And how you do that? Well, 1, clear the bugs, 2, supplement. And then what was the other part in my brain? The blood. We talked about the blood. We talked about the stool. Oh, the beta-glucuronidase. So beta-glucuronidase, that enzyme on the stool test we look at, that enzyme gets messed up due to bacterial overgrowth. And when we see the enzyme is high, that's when the estrogen dominance problem becomes more problematic because now they're recirculating the hormones. So we may do something like a calcium D-glucarate or a DIM or something else, maybe a broccoli seed extract to try to get, or could be probiotics, could just be clearing bugs, taking care of the SIBO. The glucuronidase goes back down, and now all these, quote, estrogen dominant symptoms just disappear. And it's really fun to see that.
100%. So kind of highlighting the test again, look at your symptoms. If you have pain in the upper right quadrant, under the rib cage, if you have problems breaking down fat, if you're seeing a lot of your fat, your stool sinking or floating on top, not sinking. If we run a comprehensive stool test and we see a lot of steatocrit, undigested stool, we see that greater than 10 or 15, whatever that lab marker is right in that area, we got problems. And then we got to dig in deeper. And this could be the reason why you have hormonal issues too. So we have to highlight that. Is there anything else in this topic, Evan, that you want to go into that we haven't gone in deep enough?
I don't think so. I would just tell people that if you feel discouraged or, you're facing surgical removal of your gallbladder, I'm not saying the gallbladder can always be saved. I had a friend of mine, she's in her late 50s, maybe early 60s at this point, and she was having major gallbladder pain. And I told her about taking digestive enzymes, but the pain just continued to grow. So, I said, hey, you might have to, go to a doctor and get this checked out. This is very recent. So she did. And her gallbladder function was basically nothing. And she went in and she had to get surgical removal. And because there was so much inflamed tissue around her gallbladder, they couldn't do the laparoscopic, where they just leave a small surgical site. They had to really cut her open, like 6 to 8 inches. They had to take out the gallbladder. And the surgeon told her that her gallbladder was so heavy full of stones that it felt like a concrete block. He said there was no way you were going to save this gallbladder. So I think there is a point of no return where surgical removal does happen. We're not shaming anybody or making fun of anybody if you got your gallbladder removed. That sucks. Like, she had to get it out. There was no turning back. And now, you know, she's got tubes coming out of her stomach to drain her bile until she recovers from the surgery. So obviously that's an extreme case, but man, you know, it can get to a point where surgery is the only option, but we're just trying to help you before you get to that point.
Yeah. So if we don't have enough, if we don't eat good fats and we don't have good gallbladder flow, then what happens is it's like not changing the oil. A lot of that bile and that cholesterol can crystallize. And then over time, those crystals can produce more and more crystals. And then imagine these little crystals that are like little miniature like porcupines. And imagine that gallbladder contracting. It's like giving a big porcupine a nice hug, right? Probably not the best thing. So that can create a lot of inflammation. And the more little porcupines you have in your gallbladder, the bigger issue every time you have fat, it contracts. And then also we can have potential pancreatitis because of it, because those gallstones can eventually can block the bile flow, and that can stop pancreatic enzymes from flowing into the small intestine. So that can create more inflammation. So the more this issue, the underlying cause goes unaddressed, the more the inflammation accumulates. There may be a drastic solution of cutting out the gallbladder. Now, I would say the vast majority of the time it can be saved. You have to make the food changes. We also do a lot of gallbladder bile support. We'll also use things like phosphatidylcholine. We'll do beetroot powder. We'll do taurine. We'll do dandelion. We'll do artichoke, fringe tree. These are herbs that are designed to help, one, thin out bile flow. They can smooth out the little crystals. So imagine like kind of coming in there and smoothing out all the little porcupine barbs. That way they aren't as sharp. And then we can be very careful with our fat consumption. Maybe we do the tiniest amount possible. A lot of the coconut fats are easier to process and digest. So maybe we do more coconut fat. And we just do the largest amount of fat we can handle without issues. We up the enzymes, we up the bile salts, and then we give a lot of those herbs to smooth out the bile flow, thin out the bile, and smooth down the crystals. We'll even do some like extra phosphorus drops to even thin out the bile stones as well.
Yeah, I do beet powder every day. You know, part of that's for my circulation issues due to all the mold in my body. So the beet powder has been really helping. But, you know, back to my friend, you know, she's a woman. She's over age 40. She does have excess weight. You know, she is overweight. She is very sedentary. She did have some familial health issues as well. You know, any family history of diabetes, other type of issues like that can increase the risk of gallstones, which then increase the risk of these problems. So if you were to take all of the things you don't want to be, sedentary, you know, overweight, etc., poor diet, she had all those things against her. So I'm not saying that everyone's going to end up like that. Her case was just extreme, but you know, I just wanted to point out, hey, sometimes there may need to be a surgical removal, but we want to try to prevent that. Statistics I found say there's about 750,000 surgeries every year for gallbladders.
Exactly. And then we kind of talked about our women, right? Our fat, 40 and female. The big issue is estrogen is a big cause of kind of making the gall, making the bile more sludgy. So is insulin. So insulin's also another stimulating factor. This is part of I think why the fat comes in there, because the more weight you have, typically it's more insulin resistance. Insulin's that hormone that sticks sugar into the cell, converts it to fat. So if you have more insulin, that's a greater likelihood of making the bile flow more sludgy. So if you have high levels of insulin, that's going to sludge up the bile flow. And then if we have high levels of estrogen or just estrogen dominance, that's going to sludge up the bile flow as well.
Yep. I'm sure we could keep going on this topic all day, but we should probably wrap it up. Reach out if you do need help. You can go to justinhealth.com, and Justin's Summit is coming up very, very darn soon. So I don't know when you're listening to this. If you listen to it in the future and you already missed out, well, you can purchase his summit. But if you're listening to it ahead of time, his summit is going live very soon in 2 weeks at the first week of March. So go to thyroidresetsummit.com. Go register for Justin's event. It's going to be awesome. I interviewed him, which I thought was probably one of the best interviews possible. And he interviewed me, and I talked about some other stuff that he didn't talk about.
And so one make of the best interviews too.
Thank you. So,
for sure.
So go register. It's going to be probably one of the biggest events of the year, called Thyroid Reset Summit. So thyroidresetsummit.com. Go check it out. It's run through Health Talks, which is like the Apple of summits. They do a great job of putting things on. And there's, I don't know, 30 other experts on there. So
30 great experts. And also I'm giving away the first 3 to 4 chapters of my new book coming out, The Thyroid Reset. That book will be coming out in the next few months here. So get your free intro copy. And then I really appreciate you guys picking up the book as well. Get me up there on the Amazon ranking so we can help more people. I appreciate it. And also, just to finish with this article here, the conclusion, very important here for gallbladder issues. Just try to tie it home. And we repeat ourselves a lot because repetition is the mother of skill. Here's the conclusion. Insulin resistance is a risk factor for the incidence of gallbladder sludge and stones during pregnancy and after. And then it says insulin resistance may represent a causal link between obesity, overweight, and gallstones. So our big mechanisms here, just kind of coming in full summary. So if you missed the whole entire podcast, if you get this one thing, you got it. High levels of insulin increase gallbladder sludge. High levels of estrogen or estrogen dominance increase gallbladder sludge. Inflammatory foods, right, that drive insulin, and inflammatory foods that are paleo-friendly, like pork, like onions, like eggs, like coffee, may be an issue. And then, of course, the low HCl levels, the low-fat diet, all of those things, and eating in a stressed-out environment. Those are going to be your big 3 or 4. And then also infections, giardia, gluten sensitivity, SIBO. All of those things are going to drive probably the big 5 factors: infections, insulin, estrogen dominance, low HCl enzymes, and then hidden food allergens. Those are your big 5 factors of this gallbladder issue here.
Yeah, well said. And I love my friend to death, but my wife and I were driving in the parking lot the other day, and and then we see our friend who just got her gallbladder taken out, and she's sitting in the Taco Bell drive-thru. And I'm just like, no, that's exactly what got you in this problem in the first place. So the diet is so critical. You can't skip it.
100%. Excellent. And for anyone enjoying this, I'm going to do another live Q&A here tonight, at the very end of the day, probably around 5, 6 o'clock here Central Time. Make sure you subscribe to the YouTube channel. We do a lot of live Q&A. So go to justinhealth.com/YouTube. If you're listening to the channel now, make sure you hit that bell. That gives you the notification. So if you're on your phone, it'll pop up. I say, Dr. J's doing a live chat. Even if you're not around for it, just put your little question in. So we do a live Q&A. It's open question. If it's a topic, keep your questions to that topic. If it's a podcast, we may or may not get to questions because we kind of get in our flow state, and we may just be really focused on our conversation.
Take care.
Hey, Evan, you have a good one. Take care.
You too. Bye.
Bye, everyone.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.